I'm really delighted to welcome you to the launch of Origin. Origin is a really ambitious and exciting programme, an online museum to help young people. We know the mental health system is in crisis. We know there's not enough support for young people. Waiting lists are long, and also the types of care we offer don't always suit young people. They find it stigmatising and sometimes invalidating, and therefore difficult to negotiate or even come back for a second meeting if they do get a first meeting in time. So the online museum in principle is about disrupting the current offer to young people. They themselves have told us that they enjoy the stories. They want stories about different people from around the world as well as people like them, and that helps them take perspective and feel differently about themselves. So we really hope you enjoy it, and we hope this will lead to interventions that will change the landscape. Of course, we're applying careful scientific methods. We're working with different disciplines: sociologists, anthropologists, philosophers, psychiatrists, psychologists, social workers, a whole range of people really thinking very hard about how to improve the offer for young people. And they ultimately will judge whether we've done a good job, and our beneficiaries will tell us where we can improve. So I'm looking forward to the long journey.
Would this project have got funded 10 years ago?
Definitely not. Even now, when we got it funded, when we applied, it was an outsider, I felt, in terms of what normally is funded. So I really thank the National Institute of Health Research for taking a chance, but understanding the vision and understanding why we really need new types of research, disruptive research, which includes co-design and the involvement of young people in every aspect of the work. And no, it wouldn't have been funded, and I hope this is the beginning of many more similar projects being funded in the future.
And if your vision for this particular study is borne out, what are we going to have at the end of it that's going to be useful for policymakers?
The study itself is going to, I hope, be changing the way people think about research, and we'll have more young people involved in research. That means their voices will be heard. The study itself will be changing the people who get involved in the research in any capacity, not as participants. So wherever we do the research in several venues, because it's a participatory process, they themselves will be thinking differently after the research. Ultimately, we're going to learn a lot about how to provide online museums for a diverse range of young people, diverse by identity, ethnicity, neurodiversity, and geographical location as well. And so we'll find out how to personalise this as much as possible for people from diverse backgrounds and diverse circumstances and contexts. Therefore, I hope it's an offer that people will adopt and take up, and will help people either whilst they're waiting on waiting lists, or irrespective of whether they seek help formally, that this is helpful to them in improving their own health and well-being.